So good morning and welcome to this virtual town hall on infection control and safety in home care. My name is Barbara Fain. I'm the executive director for the Betsy Lehman Center for Patient Safety, which is a state agency in Massachusetts that works to improve the safety of healthcare in all settings across the state. So we all know that strong infection control is needed to prevent the spread not only of COVID-19, but of many other infectious diseases that are common in home care and congregate living settings. We also know that it's really not all that easy to build and sustain knowledge among staff about how to keep these infections under control. And so that's why we're really excited to be here today, partnering with Mass Home Care to bring you this town hall. And this is actually a part of a suite of educational tools and resources we're developing to help you keep your clients and residents, your staffs, and your communities safe during the pandemic and beyond. So we have a really full hour plan for you. First, we're thrilled to be joined today by Secretary of Elder Affairs, Elizabeth Chen, who's going to offer introductory remarks. We're then going to take a tour of some of the materials we've developed to support home care providers on infection prevention and control. And then last but not least, we've reserved a good amount of time for questions and answers. So before we get going and really get into the heart of the program, we're going to pull up a quick poll. And you'll see it on your screen, and just why don't you take a moment to answer a couple of questions. You can see there are two, and you can scroll down on that right hand side to answer those. We just want to know a little bit about who's in the room today, and we're going to share the results in a minute so you can see, so we all can get a sense of who's here. And as you are doing that, I do have a few housekeeping items to go over. I know many of you have become experts on Zoom during the pandemic, but not everyone, and it's always worth a reminder. So please take a moment to note where that chat icon is on your screen, and you can click this to open a box where you can type any questions you might have. And I mentioned that Q&A session at the end. You can just go ahead if you have questions along the way. Just type them in. You don't need to wait till the end, and we'll get back to those later in the program. Also, if you happen to run into any technical issues, you can send a chat to Megan Carey, and she will try to help you out. I should mention also that this meeting's being recorded, and your chats are also, any chats you put in that box will be retained as well. But you don't have to worry, your video actually won't be displayed on a recording. And of course, if you have any concerns about the recording, you can send a chat message to Sam Bissell, who's there under the Betsy Lehman Center logo. And don't worry about remembering all of this right now. Everything I just told you is visible on the right-hand side of your screen, and will be there through the entire town hall. So why don't we go ahead and post the poll results. And as you can see, we have like a really great mix of people in the room, actually over 150 of you. And so I think this is going to be a really, this is going to be a terrific conversation. So now, without further ado, I'm delighted to introduce Dr. Elizabeth Chen, who is the Secretary of the Executive Office of Elder Affairs. Secretary Chen was appointed to her current position by Governor Baker in June of 2019. And prior to taking on that role, Secretary Chen was an assistant commissioner at the Department of Public Health, where she oversaw licensing of healthcare professionals and facilities, as well as the state's Determination of Need program. And before joining the Baker administration, Secretary Chen served as the president and trustee of the New England College of Optometry and New England Eye Institute, as well as president of 2 biotech companies. So please join me in welcoming Secretary Elizabeth Chen.
Thank you. Thank you, Barbara. First, I want to thank the Betsy Lehman Center for producing these videos and for convening us for this very important conversation today. The Executive Office of Elder Affairs supports home care for 60,000 individuals every year. And what you do is critically important. You are enabling people to remain at home and receive the care that they need, both the supportive as well as the medical care that they need, so that they can be in the community of choice in their home. And so what you're doing today is very, very important. And I want to thank you for coming together to have this conversation, to watch the videos. We recommend that you practice, that you have individuals in your organizations practice and watch each other and develop the muscle control and the muscle memory that's needed to execute on proper donning and doffing of protective equipment, because that is one of the areas where there can be a break in infection control. And so we've all come a long way in the past 7 or 8 months. And we know that cases are rising again. And I want to point to the Stop the Spread communities at any point in time. The state is paying for testing in 18 to 20, sometimes 22 communities. And there are multiple locations within each community. And so we recommend that if you want to have individuals tested on a regular basis, if they're providing care to people at home, please make use of the Stop the Spread communities. Be particularly vigilant about communities where we have high transmission rates, and those are tied with the Stop the Spread communities, because transmission from staff to client can happen and has happened. And certainly we want to make sure that we reduce that risk as much as possible. We know that asymptomatic individuals can be transmitting the virus. And so that's why it's so important to have a certain amount of surveillance and testing, even when people are asymptomatic. And we encourage you to give your staff time and flexibility so that they can get tested. And then finally, we are entering flu season, and so I want to encourage you to get your flu shot. The CDC has indicated that it is possible to have both the flu and COVID at the same time. And I can't tell you how scary that can be. And at this point in time, we do have flu vaccines, and they are widely available. And I want to encourage people to go and get vaccinated. So back to you, Barbara.
Great. Thank you so much, Secretary Chen, not only for joining us this morning, but for really everything you're doing to ensure that the home care workforce is prepared to keep themselves and their clients safe. And as you mentioned, especially now as we're facing the combined challenges of COVID-19 and seasonal flu, which is going to be, it's going to be a challenge. I'm now really pleased to introduce Lisa Conley, who is our Director of Policy. And Lisa's going to walk through some of the resources that the Betsy Lehman Center has developed specifically for home care. And we're really excited to be sharing those with all of you. So over to you, Lisa.
Great. Thanks so much, Barbara, for the introduction. And thanks again to Secretary Chen for joining us this morning. I think it was really great to hear from her. As Barbara indicated, I'm going to spend the next several minutes walking you through an array of materials that we've developed at the Betsy Lehman Center in partnership with Mass Home Care and with others, other partners who are working with us on this project. Before I do that, I just want to take a few minutes to acknowledge those partners who've served on our Home Care Advisory Group and who continue to contribute to this work and have been working with us for about the last 6 months on all of these materials. They've really helped us sort of understand the challenges that home care workers face in trying to stay safe during this pandemic. And so we are so grateful for their support and their help. As you can see from this slide, this is a pretty large list of contributors. We have a number of associations represented in addition to Mass Home Care. We have the Home Care Alliance of Massachusetts. We have the Home Care Aid Council, a number of organizations that represent assisted living facilities as well as nursing facilities, along with our state government partners who've joined us and provide wonderful contributions, and advocacy groups that that represent the disability community, as well as union support. So we're really thrilled to bring all of the voices to the table today, and are grateful for their support. Next slide, please. And now I'm going to turn to a video that we've created in partnership with the partners that you just saw. Before we play it, I just want to note that this video was created to sort of show the full complement of personal protective equipment that a home care worker or other healthcare worker might use. It's not in any way intended to suggest that you need all of these different types of personal protective equipment when you're doing sort of everyday home care activities. So I just want to make that clear up front. We're going to show you how to use like a face shield and shoe coverings and a gown, but it's not intended to sort of imply that all of those things are necessary or even desirable when you're doing sort of typical home care tasks. In a few slides, I'll show you another resource that we have that can help you sort of think through what types of personal protective equipment you need for each individual type of activity for home care. But I just wanted to say up front that we're going to show you everything, how to put on personal protective equipment and take it off in this video. But by no means are we suggesting that you need every last piece of this in order to stay safe. In fact, you probably don't need it. So, so without saying anything more about that, I'm going to ask Michelle to cue up the video.
Stay safe. This is your guide to wearing. Stay safe. This is your guide to wearing personal protective equipment. As a member of the home care team, you play a valuable role. Taking steps to keep yourself and others around you safe and healthy is really important. There are many kinds of viruses and other germs in the home care settings where you work, and you can't always tell when people are sick. Even people who look or feel well can be contagious, exposing others to infection. Wearing personal protective equipment, or PPE, is essential to protect yourself, your clients or consumers, and your family and friends from COVID-19, influenza, strep, and other diseases. Knowing how to put on and remove PPE correctly is the best way to prevent viruses and other germs from infecting you or the people you come in contact with. The good news is, putting on and removing protective gear is not difficult. Following some important steps each and every time will help ensure you get it right. You can do this. So let's get started. This is Miria. She'll show us how it's done. First, let's review the protective gear you may need to have with you when visiting a client or your consumer employer. Depending on the situation, you may not need to wear every piece of PPE we're about to show you. Your supervisor or consumer employer will tell you what types of PPE to wear. Generally speaking, it may include some or all of the following items: a disposable gown or jumpsuit to cover your body and arms. Make sure this is the correct size for you. A face mask or a respirator. Either a face shield or goggles. Coverings for your head and or your shoes. And gloves. In addition to your protective gear, you'll need hand sanitizer when putting on and taking off your PPE. It's a good idea to have clean trash bags on hand for disposing of your PPE after use. Let's review a best practice for putting on or donning your PPE. Make sure you put on your protective gear before you enter the client or consumer's home, or if in a care facility, before you enter their room. Set up your trash bag now, so you'll be ready to dispose of your PPE later. If you didn't leave your jewelry at home, remove it now so it won't tear your gloves. Remember that good hand hygiene includes keeping fingernails closely trimmed and not wearing artificial nails. Start by cleaning your hands thoroughly with sanitizer. Squeeze a generous amount of sanitizer in your hand, about the size of a quarter. Rub your hands together vigorously for at least 20 seconds until your hands feel dry. Singing happy birthday twice is one way to make sure you're taking the full 20 seconds. It may seem like a long time, but it's necessary to make sure you're eliminating germs that could make people sick. Next, put on the gown or jumpsuit if you are using one. For the gown, place your arms through first. Then secure all the ties. Make sure the gown covers you from your neck to your knees, as well as your back. If using a head covering, put that on now. Make sure to tuck your hair completely under the head covering. Now, you're ready to put on a clean face mask or respirator. There are several different styles of face mask. You will use what your supervisor or your consumer employer has supplied for you. Place the face mask over your nose and mouth and secure the elastics around your ears. Make sure the mask covers your nose and extends below your chin. If it has a flexible band for your nose, gently press to fit this to your face. If using a respirator, put it on as you were instructed when you were fitted for the respirator. If you are using eye protection, put that on next. For goggles, make sure they provide good coverage around your eyes. If using a face shield, it should cover your entire face. Put shoe coverings on next if you're using them. We're almost done. But before you put on your gloves, clean your hands again for 20 seconds. Finally, put on your gloves. Pull the gloves up fully until they cover the wrists of your gown. That's it. You're now ready to enter the home or room. Now, let's review a best practice for safely taking off or doffing your PPE. This should be done outside the residence. Start by removing your gloves. It's important to do this in a way that avoids contact of your skin with the outside of the glove to prevent viruses or other germs from getting on your hands. Pinch the outside of the glove near your wrist. Peel the glove downwards, pulling the glove inside out. With your ungloved hand, slide a finger under the wrist of the other glove. Again, pull downwards, turning the glove inside out. Then dispose of the gloves. If you're wearing a jumpsuit or gown, remove it next. For the gown, start by undoing the ties at the neck and back. Then reach up to your shoulders and carefully pull the gown down and away from your body. Touch only the inside surface. Roll the gown up tightly, then dispose of it. At this point, clean your hands again for 20 seconds. If using a face shield or goggles, remove that next. For the face shield, carefully grab the strap and pull upwards and away from your head. Avoid touching the front of the face shield or goggles. You will need to disinfect these before your next appointment. If you're wearing a head covering, remove it now. If you will be cleaning and reusing it, place it in a separate bag. If wearing shoe coverings, remove them now. Clean your hands again for 20 seconds. Next, remove your face mask or respirator. Unhook the elastics from your ears and carefully pull the mask or respirator away from your face. Make sure not to touch the front of the mask. Dispose of the mask, or if you will be reusing it, place it in a separate bag. Finally, clean your hands once again for 20 seconds. You're now ready to move on to your next client. We've shown you the basics. Now it's up to you. Practice putting on and removing your PPE to get familiar with doing it properly. Take your time when putting PPE on and taking it off. Don't take shortcuts. And remember to change your gloves and wash your hands as frequently as you need to during your visit. Doing this correctly each and every time means you won't pass viruses and other germs to others, including your family and friends. After all, keeping people safe and healthy is what it's all about, right? Remember, your community is counting on you. You got this. You can find more information online. Thanks for watching.
Great. Perfect. Thanks so much, Michelle. And so now I'd like to walk you through some of the other resources that we have available in addition to the video that will help keep the home care workforce safe through the pandemic and beyond. So this is the main landing page that we've developed specifically for the home care audience. As you can see, the URL at the top is long, but it's the one that goes directly to your site that contains all of these various resources that I'm about to run through. The other way to get there is through our main site. If you just Google Betsy Lehman Center, it will come up in your Google search. If you want to also add home care and COVID to your Google search, it will get you even closer to the actual link you see here. But we encourage you to go there after the webinar and look through all of the resources that we have available to you. Next slide. So the video is at the top of the page, as you saw in the last slide. Its runtime is about 9 minutes, which we just listened to. It is translated into Spanish, Haitian Creole, and Brazilian Portuguese. And we have another sort of slight version alternative that has a different script that is specific to individuals who are working in congregate settings. But the one that you just saw is the one that is created specifically for home care. Next slide. If you scroll to the bottom of the page that I showed you, there is a list of curated informational links. And these are links that we've pulled out from various sources, including the Centers for Disease Control and Prevention, the Safe Home Care Project at UMass Lowell, and the Massachusetts Department of Public Health, as well as others that are available. So these are the list of links that we've specifically pulled out as being applicable and appropriate for the home care audience. I mentioned earlier that there's a good resource about the types of PPE that you might want to use. And if you look at the top link in the personal protective equipment section here, you see it's recommended PPE for different home care tasks. And that's developed by the Safe Home Care Project at UMass Lowell. And that can help answer any questions that you might have about the types of PPE that you'd want to use for various home care tasks. Next slide. So in addition to the links to the outside websites, we've also created a home care toolkit that you can use. Again, this is all on the same home care landing page, so you don't have to go to more than one place to find all of these things. And about in the middle of the page, you'll see home care toolkit, which is in a blue box. And it's full of resources that you can use in conjunction with a PPE video or any other resources that you find on our site. You can find the link to the resources, again, in this blue box by clicking on the orange link. Next slide. So if you click on the toolkit link, it'll take you to an array of resources that are available and free for use. We encourage you to take a look at it and to share it with anyone else who you think might be interested in it. It includes flyers that provide easy to use diagrams that are illustrated and quick, easy reference. They also have step-by-step instructions about how to clean your hands. We have door signs that can be used by clients to help remind visitors to their homes about how to stay safe during the pandemic. We have PowerPoint slides that you can sort of use and customize to your needs. You might use them in a training, you might use them in a staff meeting. To go through the basics of infection control and PPE use. And then finally, we also have a quiz that helps test PPE knowledge that you can use in conjunction with the video if you wanted to use it as, say, an in-service or a training to sort of understand what people got out of the video. Next slide. And this just shows you a couple of examples of the materials that are available in the toolkit. All the way on the left of your screen is the very sort of simplified version of donning and doffing of PPE. And that includes a face covering, a face mask, and gloves, which again are going to be the most common types of PPE that you would use for home care setting. On the right-hand side in the top upper right-hand corner, we have the sign that you can share with clients or consumers that helps them sort of broadcast to visitors to their home about how to stay safe. So, wear a face covering when you come into my home, please clean your hands frequently and keep your distance when possible. And then on the bottom is just a clip of the quiz. And again, it's a one-pager, so it's fairly simplified and pretty easy to use. And we encourage you to use it with the video to sort of gauge what people learned from it. Next slide. And again, we always invite you to share your feedback with us. The email address on this screen will go to our general inbox, and so we can share it with our communications team or whoever else needs to get your feedback. But we do welcome your thoughts about the materials that we're sharing with you today. And also if you're using other materials that you think would be helpful to share with others in the home care field that you think should be showcased on this website, we are more than happy to take a look at that and share those useful resources with others. So we encourage you to email us and get in touch, let us know what you think. And now I'm going to turn it over to Lisa Gorgoni, the Executive Director of Mass Home Care, who will share her thoughts, and she's going to lead the discussion portion of this webinar. Thanks.
Good morning, everyone, and thank you so much for joining us. It's really a great turnout this morning, and we just appreciate all the time that everyone's giving to this really important topic. I also want to thank Secretary Chen for joining us to give welcoming remarks. It's great to have her here to just express how important this network is to our home care system, our Commonwealth, and also thank to the Betsy Lehman Center for putting this together. I just feel like it's been such a pleasure to work with them. They have been really engaged in trying to make sure that the home care network, our ASAPs, the Councils on Aging, the home care providers, all feel and know that we are essential and part of the healthcare team in the home and providing some really important services to people each and every day, but even more so now during COVID. So thank you to Betsy Lehman, thank you to Secretary Chen and her staff, and thank you to all of you. I did want to just say today, next slide, please. For Mass Home Care, I think we really have been, since the middle of March when COVID hit, really making sure, working in collaboration with all of our ASAPs and Elder Affairs and all of our partners, that we continue to provide safe care in the home, and really have been committed to that mission. And we have worked closely with Elder Affairs to develop some protocols to make sure that's the case. And what we have been doing now with Betsy Lehman is making sure that we're also aligning our protocols with the most up-to-date CDC guidance that's available. Also, again, with some of the materials reviewed today, really looking at how do we provide information and training resources to the home care network. And I think when we talk about home care, it's really all of us. It's all of your direct care people, either at your ASAP, at your provider agency, in the community, people who are out there day to day providing care, making sure they understand the social distancing requirements, have the appropriate PPE, are doing a daily assessment to make sure they're not having symptoms, have training. And we're also educating the consumers and the family. And I think that these resources, again, are for our network, but could also be for families and consumers to understand what we're doing to make sure that as we're providing the needed care, it is safe. I also just want to highlight yesterday, the Executive Office of Elder Affairs did share with the ASAPs some updated information related to the critical incident reports that the ASAPs have been making to Elder Affairs related to COVID infection. And I think it's really interesting information when you consider, all the media attention on nursing homes and just the real high level of infection in nursing homes. Throughout the COVID crisis, Massachusetts, our home care services were providing at least almost 47,000 consumers with care during COVID. And within that time frame, the ASAPs reported only about 674 situations where consumers had tested positive. So the infection rate in home care is very low as compared to nursing homes. And actually the reported deaths from COVID, again, they could have been people in nursing homes coming back or also in home care, was only 160 in the home care network. Again, when you think about the nursing home network, which has seen over 6,000 deaths, we have much safer levels. And again, that's really because all of you have been so vigilant in making sure that you're providing appropriate care as needed, using the guidelines, and families have been, trying to keep their loved ones home as much as possible. So we need to continue that, especially as we enter the fall. I think that that's, a big thing for all of us to make sure that we are remaining vigilant. Again, I would echo what the secretary said earlier about flu shots. We are encouraging everyone to get a flu shot, to encourage their staff to get flu shots. We just want to make sure that we can remain safe. We're definitely not out of the woods yet, everyone knows that, but how do we continue to be as successful as we have been? And again, working with Betsy Lehman to develop additional resources, materials that could help people in being as safe as possible as we provide care in the home. Next slide, please. So we're going to start the Q&A. And before we begin, I'm just going to do the reminders, but I also just want to state that, today we're going to open up for questions for people. We did get some questions in advance, and I'll start with a couple of them. But generally, this is hopefully a conversation. We're going to talk about what we've seen today, what Betsy Lehman's put together thus far. But obviously, we welcome feedback on additional resources that we can develop with Betsy Lehman, and also whether or not having another town hall would be useful. And again, we'll see how the Q&A goes, but we want to do more. We're going to do the best we can to answer questions today, but if we can't answer them, we will come back with responses from Betsy Lehman and DPH. And actually after this, we will actually share the slides, but also we've received some of the questions in advance and answers to those questions. So those will be shared. So again, this is a kind of ongoing conversation we want to have. We'll do our best today to answer questions, but please know we want to continue that. And Mass Home Care is really committed to making sure that we continue to update and provide as much information as possible to our members. So just as a reminder, all attendees are muted automatically. when we open the Q&A, there's a chat button on the side where you can ask questions, enter in questions if you'd like. You can also raise your hand if you want to speak. I will go through the questions and answer them as best we can, again, with Betsy Lehman. But certainly, if you want to raise your hand and speak, we're happy to have you unmute yourself and then ask the question. But we will call upon you to do that after you raise your hands. So next slide, please. Okay, so I think the first question we wanted to put out for everyone was really kind of what questions you have so far. And then the second piece of that is, of the materials we reviewed today, are there other resources that would be useful to you, helpful to see? So I'm actually going to start with the question we received in advance. I think it frames a good message for everyone, and I think it kind of aligns with a lot of the questions we did receive. And then I'll read the question, read the answer, and then we can kind of go through the questions that are on the chat so far. So the question is, how confident are we that sustained contact is required for COVID transmission? If we are confident, then do we need to Purell our hands every time we touch a doorknob or sanitize groceries? And this is a response that Betsy Lehman received through DPH. And again, it's according to CDC. Coronavirus infections are spread mainly through exposure to respiratory droplets of an infected person when another person comes in close contact with that infected person. Close contact is defined as contact within 6 feet of another person for 15 minutes or longer. COVID-19 may be spread through airborne transmission or through small droplets and particles that remain in the air for minutes to hours. Typically, these exposures do not require close contact, but do require a person is within an enclosed space with the infected person, often without adequate ventilation. It is less commonly spread through contact with contaminated surfaces, but the best way to manage this risk is by cleaning your hands regularly to wash rather than trying to disinfect groceries or other surfaces. So the bottom line is that we should always engage in good hand hygiene. After all, it does prevent the spread of many infectious diseases, including COVID-19, but we don't need to worry about sanitizing everyday surfaces unless there's a reason to believe that they've come in contact with bodily fluids of someone who is infectious. So again, we received a number of questions in that vein in advance of this program. The answers will be shared with everyone, but I think they all kind of relate to the materials that we have, provide more resources, but that's kind of a general sense of a lot of the questions we got in advance. So I'm gonna now go to the chat and see if I can answer some of the questions that are here. And the first one we received was from Jay Kunga. And they had asked about ASAP consumers, wondering if direct care workers can be tested weekly. Is that encouraged? Is it mandatory to test direct care workers at this time? And I would say that, there is no requirement for, every individual direct care worker to be tested at this time. However, as the secretary noted in her initial comments, the Commonwealth has committed to a very comprehensive Stop the Spread campaign, which does offer free testing for anyone who feels they may have been exposed or are symptomatic. So therefore, those people, if a worker feels they've been exposed, they may be symptomatic, they question it at all, we would strongly encourage them to go to one of the free testing sites to be tested. But there is not at this point a mandatory testing requirement. I don't know if Lisa wants to add to that, Lisa Connolly at all, but that's.
No, I think that's great. Thank you.
Okay. I'm just going to read through the questions here and get to the next one. And if anyone wants to speak and they want to raise their hand, we'll know. Okay, there's a question in here from L'Oreal about working in office spaces and exposure. Again, I think that all the office spaces we are, if you look at the resources that are available, I think the thought process between office spaces are that there are certain, rules in terms of wearing masks, washing your hands, what have you. It's the same exposure that people have when they go to the grocery store. So certainly people should be following those rules as they're in the office. I think that it's important for people to balance, certain risk, and certain people, who have illnesses shouldn't be going to the office. Obviously, it's about self-assessment and what have you. So we can take more of that back again for more further information on that question.
Lisa, there is one person with their hand raised if you'd like me to.
Great.
Hi, good morning. So I saw the question come up regarding working in the office, and I think as a network, we've all been really diligent, Lisa, as you said, in providing a safe working environment. I can speak to Tri-Valley, but when we reopened the building, we're currently at 50% occupancy, and really paying attention to how many people do we have in the building, what are we doing to keep them safe? And again, I think I'm looking at some of my cohorts here. Marjorie, I can see you in your office. I think as we have resumed working, the changes that have taken place here at Tri-Valley, we installed the hands-free faucet systems, the partitions in meeting rooms. Our workspaces are large enough to meet the criteria. But as you said, making sure of the social distancing, the mask wearing, the hand sanitizer usage, it's really been critical in us encouraging people to come back in. And I think that the benefits of having people back in the building are the increased communication among departments. That's really hard to obtain when you're doing GoToMeeting or Teams or Zoom, to keep that teamwork and camaraderie going, really to the benefit of our clients. So I think it's great that we have the ability now to be back in the office. I can speak for Tri-Valley. We will never be 100% back working from the office. Our work from home model is now kind of here to stay. But there is something to be said for being able to be in the workspace safely and with a health, a mind towards our health. So.
Yeah, there's a lot of, and thank you, Lisa, that's really helpful. There are a lot of questions in the box now about how long a visit should be, a planned visit. And I think that with the Elder Affairs guidance that came out and also the Mass Home Care guidance, I think we are recommending that visits be limited to 15 minutes in as much as possible. I mean, I think that, that is in line with the CDC guidance that I reviewed earlier and that, are part of the materials that Betsy Lehman has shared. So obviously we know that they may not be possible in every situation, but we would love for staff to really use a hybrid model where they're going in advance and talking to the person either via phone or remote, getting whatever information they need, and using that visit as a hands-on moment where you're seeing the person, getting signatures if needed, but it's really to kind of be brief as possible, to not be longer, but again, 15, 20 minutes, but to try to keep as close to that guideline as possible. So that is our recommendation. Amy Bullitt from Worcester, I think, has a question. Do you want to speak, Amy? Unmute yourself.
Yes, I think I just wanted to piggyback on what you just said about the home visits. I think one of the other things that we've kind of been doing as a best practice is just kind of guiding our staff to really prepare ahead of time for those in-person visits by having a phone call with the consumer and any other visit participant to kind of set the stage for how that visit's going to look, in terms of what PPE our staff will be wearing, the social distancing that is required, asking if they have a mask and telling them that really without a mask, it's kind of a no mask, no visit type of thing. We want to make sure that we are protecting our consumer as well as our staff. So do you have a mask? If you don't, we would be happy to mail you a mask, and anyone else in your household. Letting them know that those visits are only going to be between 10 and 15 minutes, and the reason for that. And to also support our staff to let them know that most likely, I mean, a lot of these consumers haven't had people in their home. So they could be, you know, they're very isolated. They're looking for that companionship, and they really very much are looking forward to that visit. But letting them know that, you know, we have to keep it to that 10, 15-minute time frame and the importance of that, and kind of guiding them on how to communicate that to the consumer. So I think it's a lot of prep work ahead of time with the staff and with the consumer to make sure that everyone understands the parameters of the home visit and why those things have been set up, and ultimately is to keep the consumer and the staff members safe.
That's really helpful feedback, Amy. And I think that was also part of the next set of questions to kind of see best practices, because I do think there's a lot of questions about, you know, these guidance. How does it actually work? What does that mean for me as a staff person out there in the field? How did that, you know, how did that translate? What can I do to make this clearer, the information clearer for our consumers and for our staff? So thank you for starting that feedback, both Amy and Lisa. So I think, you know, with that, I do have a couple other questions I want to get to, but I did want to see if anyone else, you know, as a prompting before I get to the next question, you know, any other best practices people want to share. If you want to raise your hands, we'd love to hear, especially with some of the questions that are in the chat. I will answer the one, again, this was shared in advance from Marina Kogan, related to donning and doffing. So it's in the chat box. I will read the question. What is the best way to perform donning, doffing of PPE when working with a confirmed COVID-19 positive patient in the community setting where there is no decontamination area available? So this is a response again from DPH. And again, this again will be shared in writing with everyone following this call. We encourage you to doff your PPE outside the room or residence in the order described in the video. Disposable PPE such as gloves, surgical masks, paper gowns, and shoe coverings should be placed directly into a trash bag or receptacle. Reusable items such as face shields, head coverings, or cloth face coverings may be placed into a separate bag to be laundered or disinfected. Always be sure to clean your hands thoroughly when you are finished doffing your PPE. So I don't know if anyone else has thought about best practices they would like to share, and I'll go back to the questions. I will note that Jennifer Diaz, there's a question here, which we actually received in advance as well. And we were hoping we could kind of talk to all of you on this call today about to strategize. So Jennifer's question is similar to the one that Betsy Lehman had received. So I'll just read that one instead. What are the strategies for workers, consumers, when one or the other is not taking the proper precautions? So the answer from Betsy Lehman was, this is a great question and one that we're going to discuss as a group to see if others have developed strategies to encourage workers or consumers to take the proper precautions, such as wearing a face covering at all times when with others who are not in your household. So I would open it up to the group. Are there strategies that people feel have been helpful? I think Amy Bullitt mentioned that what they're doing at Worcester is actually, in advance of any visits, calling the consumer to make sure the expectation is that the worker will have masks on, the consumer will be asked to wear a mask, so it's clear from the get-go before the person's there. But are there other suggestions people want to share about how to deal with those situations? I know they can be tricky, and I'm just curious if other people have thought of interesting ways to address that. Anyone want to share in the chat or live?
Lisa, it's Lisa Prince. Can you hear me?
Yeah.
Oh, okay, great. So I know that we've encountered that here at Tri-Valley due to a number of different reasons. So we have, as Amy said, provided PPE to those members that need us to provide it. We have set up meetings outdoors to allow for more distancing if people have struggled to wear a mask. We've also provided masks and face shields that have a clear covering. So for our consumers that are hard of hearing or that need to see our lips moving, we've provided that as well. And then as Amy said, we do institute the policy of if there is a refusal to observe the PPE requirements, we are declining to visit that person except in the most extreme cases. Again, I think it just goes to the safety not only of the consumer, but of our workers who are going into the home.
Hi, Lisa. This is Molly.
Molly.
It looks like Jay Gibson from Montechusett Home Care said that they've started to use tablets and protective services, so as an option.
Okay. Yeah, and it's also so short here also says that they are sending a letter to consumers, again, letting them know that home visits may be resuming and discussing the basic mask and information about how the visit will occur, again, similar to the calls that Worcester's making. You know, I did have a question, there was a question here about, you know, doing an unannounced visit. I would say, you know, and I don't know if Lisa Prince wants to, you know, discuss any other thoughts. I would think that definitely, you know, with unannounced visits, you want to speak to your supervisor about that and how best to approach that. I mean, certainly in some instances, unannounced visits may be necessary, especially with protective services, but we definitely want everyone to be safe. So I would anticipate that you want to talk to your supervisor before that. And you know, again, if people have thoughts on you know, unannounced visits, that's something too we could share here. If any best practices, I know it's hard for protective services, especially.
Yeah, I would agree with that. It's Lisa Prince from Tri-Valley. That protective service is kind of a unique situation that sometimes unannounced visits are required. We're handling those on a very individualized basis and doing our best, again, with that safety and health precaution in place. So generally, I think we're using the bar that the risk needs to outweigh, the benefit needs to outweigh the risk for us to do an unannounced visit.
Yeah.
Lisa, this is Amy. This is Amy again. Hello. So I just wanted to follow up again on the question about someone who refuses to wear the mask. I think we've really tried to guide our staff to focus in on, making these visits very intentional and purposeful, and making sure that we're visiting the people who are the, kind of like the most needy, certain criteria, so that we're not just visiting, people who have strong informal supports, to minimize the transmission. The other thing I think is we always start by, talking about having an in-person home visit and going through all that information that I shared earlier. However, if someone says, no, I'm not going to wear a mask, I'll tell you right now, I'm not going to wear a mask. Okay, we're going to respect that. That's their choice. And then we'll move on to, can we do a virtual visit with you?
Right.
So now we're definitely starting to use more technology in our interactions with our consumers. So that way we can at least lay eyes on them. We are working with, trying to identify consumers who do not have the technology and utilizing the new services that have been approved through, the COVID services, to provide people with the iPads and with iPhones. So that really is very helpful to be able to facilitate that visit while laying eyes on people without actually having to go in person if the person is not going to adhere to the safety protocol.
Thank you, that's super helpful. There are some questions about N95 masks. I just want to note that we were fortunate to work with Elder Affairs and MEMA to provide the ASAP network with some N95 and other PPE, necessary PPE. So again, if you work for an ASAP, I would talk with your supervisors about N95. And there was also a question about when N95 masks should be used. And I do think that the materials on the Betsy Lehman site actually outline those requirements, or those recommendations in very detail. So again, go to the sites, but if people find that it might be helpful to have a more detailed review of those recommendations beyond what's available on the site, we can certainly do that in a forthcoming webinar. So I did want to share that as well. So I think we're just we only have a few more minutes to just kind of look at the last set of questions. I know we're not going to get to everything, but again, kind of a lot of these things we've already talked about. but common questions from your staff. Do you feel equipped to answer the questions? If not, what do you think we could provide? You know, what are the other things we can do? Other recommendations for other trainings, other recommendations for other resources, and then same for the frontline workers, and that includes, you know, nurses and PS workers. Again, do they have questions that are common, and what can we provide to help them feel more safe providing care right now? So that's the last questions. Again, I will definitely bring back, we can definitely share the N95 information specifically is available, but if people want more on that, we can talk about that in a future training. I don't think there's nothing else really coming up in the chat right now. So I think we should go to the last slide, I think, since we're almost out of time anyway. Oh, is that the last slide? Okay.
The last slide, Lisa.
Oh, okay. I forgot. I guess there is no last slide. I want to thank everyone again for being here. I think, again, like I said, this was really a start of a conversation for the network with Betsy Lehman, and an opportunity to kind of see what has been developed in partnership with them, and have you guys look at the information, go back, take a look at the materials, see what is useful and what is missing. And again, I think Mass Home Care and Betsy Lehman really welcomes the opportunity to do this again if people think this is helpful. We can certainly continue to send us questions. My email address, a lot of you have, but it's lgurgone@springwell.com. You can send emails to me directly. Betsy Lehman is putting in the website in the chat. We will be sending everyone the materials, the slides, the answers to the questions that DPH did in advance of this presentation. And again, if people have questions, share them, complete the survey that you'll receive, and we are willing to do other presentations like this if it's useful. So certainly, please let us know what you think. I want to thank every one of you for being here on a Friday afternoon. I mean, Friday afternoon, it feels like Friday afternoon, Friday morning. And again, thank you to Secretary Chen for joining us. Thank you to Lisa and Amy for being brave enough to share their thoughts. And we appreciate everyone. Have a great weekend.
Hey, Lisa, thank you.